Micheal Paul, thanks so much for joining us today.
Thank you for having me.
Can you start by telling us a little bit about yourself and about the Orthopedic Medical Group of Tampa?
Sure, I joined the practice in 2016 after retiring from the Air Force. When I initially joined the company, I was hired to actually run the call center. Um, I did that for about 2 years, and then the opportunity came on to become the human resources manager at the time. So um, I did that for 3 years. I got the company through COVID, and another opportunity for me came to become the chief operating officer of the company. About the practice, we have 13 surgeons, 12 mid-level providers, and we employ about 167 people total. Our coverage for the Tampa Bay area ranges from St. Petersburg all the way to Winter Haven, so we have about 9 offices here in the Tampa Bay community.
Can you share some of the administrative challenges that the Orthopedic Medical Group has encountered during its growth, and how have these challenges impacted the overall operations and efficiency of the organization?
When I first joined the practice back in 2016, I believe we only had 6 offices at the time. One of our things that we wanted to do, of course, was to expand, to provide more service, expand our reach of service to the community. Especially during that time, we also had COVID, which, being medical, we're not immune to the challenges of the job market. Finding call center people to hire, or just general medical assistants, always was definitely a challenge, but especially the call center side of it. We prided ourselves in providing great customer service, and one of the challenges is, of course, as you expand, is more patient volume, more call volumes. Our call volume increased, and trying to keep up with that became a bit of a challenge.
What specific administrative obstacles has the practice faced in terms of, managing like you said, the growth, the increasing number of staff members? How have you addressed issues such as, recruitment, training, maintaining a cohesive team culture?
Sure. Well, we definitely pride ourselves on our culture, and so challenges of not only finding the talent to fill those roles, but also the people to fit that culture became very important to us. So we had an interview process. During our interview process, these are the things we kind of look for. We use job boards. We sometimes we depend on our staff also to give us recommendations of people that they can recommend for us to bring on board who would fit that culture. We definitely faced some challenges in 2020, just trying to keep up. We wanted to continue to grow, but also to keep with everything going virtual. Of course, our call volume increased, and trying to find people to hire, that definitely became a challenge for us. And then to meet that challenge, we created some levels to our organizational structure to include some director level positions, and increase our C-suite, myself included, being in that. And I think we also made sure that we had the right people in place for those positions too.
As the practice has grown and expanded, what has been the administrative changes and challenges in terms of managing patient records, scheduling appointments, dealing with that call volume you mentioned, and also the communication between the providers as well?
Well, as I mentioned before, we put those director level positions as well. We gave those people the autonomy to kind of make changes and make the right choices to fit our needs. We increased our medical records department with our offices increasing. The number of offices increasing, so did the number of requests for medical records. The appointment system, prior to 2020, was kind of, I wouldn't say archaic, but when I first joined the company, we didn't have a digital telephone system. So our phones would actually ring. And so we recognized our technology limitations as well, and we invested in computer systems, telephone systems to kind of meet the demand for our skill set.
I know you've been working with a third-party vendor for administrative assistance.
Can you explain the reasons why the practice, reached out and made that relationship with that vendor? And what were the key factors or challenges that, prompted the decision to, bring on this additional support?
Sure. We pride ourselves in probably being the best in the business at orthopedics. That doesn't necessarily translate to being the best in the business in call centers, and running a call center. So we recognize that limitation. We did it for as long as we could, myself included, doing it 2 years and adding improvements to our processes. But again, we needed experts to do it. Coming from the Air Force, I was an orthopedic technician. Perfect opportunity for me to join the orthopedic practice. But when I was hired, of course, I was hired to run the call center. And bringing some of those operational and strategic planning from the Air Force into the call center got us to a certain point, but we definitely needed experts to help us. And so at the time, we made the decision, the company did, our board of directors made a decision to meet the patient demand, meet the call volume by bringing in those experts to help us.
Could you talk a little bit about the process that the practice followed when searching for a vendor to help? What was sort of the criteria, the qualifications that you considered while evaluating, potential partners?
One of the most important things for us was to ensure that whoever we brought on board was also willing to listen to us as a company on what works for Orthopedic Medical Group of Tampa Bay. When we went through the process, we did have some companies, it was either their way or not, but that's not, we're unique as a company, and that's not the way we kind of operate. We have a culture here of working hard and making sure that we take care of our people. And so when we vetted these different companies, one of the most important things that we wanted to consider is to make sure that our current staff that we had employed was able to be integrated into the new company.
Got it. How did you ensure a seamless transition and integration of going, from the call center you guys were running and the processes that you had to bringing the vendor into the fold and, making sure it didn't, interfere with patient care and all that stuff?
There's definitely a lot of video meetings, a lot of on-site visits. I think, and it may sound crazy, but the IT, the telephone part is probably the easier part, is making sure that the people that are with both our company and their company were a good fit. As I mentioned, we wanted to make sure that the people that we currently had on our staff were taken care of. It wasn't our intention at all to do any layoffs or let those people go. We wanted to give them both an opportunity to either stay with us or to join this new venture with the company. And so I think that was the most important piece of our two companies merging, or two companies joining.
In terms of, what it's been like since, what are the benefits, the advantages that the practice has experienced since, starting this new relationship?
Well, long gone are our days of 20-minute hold times. We definitely struggled with that, both because of the archaic system and as well as meeting hiring challenges. So that has been definitely a great benefit. Whenever a patient gives us a call, that is the start of the customer service experience. After they select their option, they're immediately greeted by an actual human. And so I think that is definitely important, and it definitely helped us to provide the patient care, better patient care experience with them.
And you mentioned patients and sort of the beginning of that sort of phone kind of encounter. What feedback have you heard from your patients? Have you been able to gauge, how effective the partnership has been in terms of, patient satisfaction, retention, and those things?
Well, we've been in practice for 40 years. And so a lot of their grandparents, parents, kids, uncles, aunts, we take care of the entire family in a lot of aspects. And a lot of those people remember the days when we had those 20 to 30-minute hold times. The feedback we've gotten, of course, has been positive, and that they're able to call and immediately talk to somebody. And also the feedback from our providers has been also positive, because when they're in clinic, they're the ones that are actually getting those patient complaints who say, I was trying to get an appointment with you, but I was on hold 20 minutes. And so I just came into the office to make the appointments. That's, of course, not what we wanted. And so the feedback, to go back to your question, feedback has been very positive.
What advice do you have for other medical groups and practices that are looking for similar administrative support, for them to go and search for maybe a partner to help them? What advice, after going through this process, do you have?
My biggest advice to them would be to find a company that will integrate with you and not the opposite. Make sure that the partnership is there, that they'll listen to your feedback, and that their goals essentially meet yours as well. Find people that you're comfortable with and that are willing to listen to your ideas and integrate what works for your company into whatever options that they're bringing on board.
Last question. Orthopedic Medical Group of Tampa, I know you guys have been growing a lot. What are your plans for the future? Where do you hope to bring this practice, in the next, 5-10 years?
Continued growth. I think we want to make sure that with expansion, with growth, that we don't lose the focus of taking care of the community. We don't want to necessarily grow too fast and extend our reach to and provide a poor product. As I mentioned before, we consider ourselves the best in the business. And we want to make sure that the patient care experience is not tarnished or is not diminished because we are trying to do too much too fast. So our goal is, of course, to continue providing quality care and providing an opportunity for the Tampa Bay communities to have a great place to work and a great culture to fit in. And, of course, above all, making sure we take care of our patients.
Micheal Paul, thanks so much for sharing your insights today. I really appreciate it.
I appreciate you. Thank you for your time.